Road signs along US 64 tell the traveler that help is just an exit away. But to people like retired nursing home worker Linda Gibson, the signs have become a cruel joke. They point the way to Martin General Hospital, which has been closed since last summer.
I have seen people being more fearful. I have seen people praying that nothing happened to them, that they get sick and have to go to a hospital.
Martin County, population about 22,000, is among the latest in an ever-lengthening string of rural communities that have lost a healthcare hub.
I would not want to be the CEO of a rural hospital. These organizations face tremendous challenges.
According to the Sheps Center for Health Services Research, 105 rural hospitals have closed since 2005, and another 86 are what Deputy Director George Pink calls converted closures.
The inpatient care is gone, the emergency care is gone, but there's some other type of healthcare service in the building.
While the reasons vary widely from community to community, Pink says the main factor is financial.
Many of the hospitals that have closed are located in small, declining population areas. They've got high rates of uninsured, high rates of underinsured. They tend to be older, sicker, and poorer people.
Places like Martin County, where about 20% of people live below the poverty line. Last August, the company that operated the 43-bed facility declared bankruptcy. A study showed that nearly 80% of Martin County residents were already seeking care elsewhere. Visits to the hospital were down by 42%. But like many, Williamston resident Bobby Woolard blames the county commission.
They knew the hospital was failing, and nobody tried to do anything about it. They just let it fall.
In September, local citizens sued county commissioners, alleging open meetings violations and backroom dealings. At a recent commission meeting, Verna Perry told of her 87-year-old sister, who was taken to one hospital only to be told they weren't qualified to provide the care she needed.
But do y'all care? Do you really care, commissioners? If you care, you would do something to get us a hospital here. Our people are dying. They're suffering.
Williamston Fire and Rescue Captain Kenny Warren doesn't deny that having an ER 5 minutes away was better.
A call that used to take us 20 to 30 minutes is now taking an hour to 2 hours, depending on where we had to transport to. Where we used to have one truck staffed and volunteers on backup, now we're having to fully staff 2 trucks, 24 hours, and keeping them on the road all the time.
But Warren says he hasn't seen a spike in deaths since Martin General closed.
Most of the outcomes probably would have been the same anyway.
Interim County Manager Ben Eisner says it's unfair to blame the county for the closure. But he says officials are working hard on a solution, including perhaps reopening the facility as a rural emergency hospital, a new federal designation that keeps the ER function but only allows outpatient care.
It's a real opportunity. It may not seem like one right now, maybe difficult to see how you get from one side to the other, but it does open up a lot of possibilities which the county and I know other citizens are exploring.
Meanwhile, others are trying to fill the gap. An urgent care clinic recently opened less than a mile from the old hospital, and providers like Agape Health Services have been adding staff and services, such as this new orthopedic clinic in Williamston.
All right, come on. Yes.
But Gibson says there is no substitute for a hospital. Her elderly sister, who receives dialysis several times a day, recently went to an emergency room, but was told it would be days before she could get a bed.
I'm looking at maybe death because she couldn't get in the help that she needs.
Gibson is praying for Martin General to reopen.
Might not be tomorrow, may not be next month, may not be this year, but I believe in my heart things are gonna work out. I have that faith.